Welcome to Dr Joe Unplugged. This podcast contains general information and is not in any way medical advice. Sleeping in. Turns out it's good for you. Who knew? A story on medical news today, and we'll put the link in the description below. Sleeping more on weekends may cut risk of heart disease by up to 20%, study finds. Catching up on sleep over the weekend could reduce the risk of heart disease by 20%. Sleep deprivation, often defined as less than 7 hours a night, can present a host of health problems, and we know that. And less sleep can also contribute to mental health problems and type 2 diabetes. Now, a couple of points to make first up. In an ideal world, it's nice to get some sleep through the week, but the good news is that catching up some sleep and reducing that backlog, it also does work. So if you have had a busy week, you have been to bed late, you got up early, you might have had a busy schedule, you need to catch up some sleep on the weekend, and again, sometimes the situation doesn't present itself, that is still good. So this is really what this study is saying. Now, 20% sounds impressive, and we've spoken previously about relative versus absolute changes. So 20% might be from 1% to 0.8%. So that's good. That's lowering your risk. But if the headline said reduces your risk by 0.2%, yeah, probably wouldn't be a headline, and we might not even be talking about this now. Using self-reported data from more than 90,000 people who participated in the UK, and this is a quote, Biobank project, a research created 4 cohorts ranging from those with the most compensated amounts of sleep with those with the least. They followed the subjects for 14 years and analysed hospital records and basically found those with the most compensatory amounts of sleep were 19%, which is a bit less than 20, but we'll allow it, less likely to develop heart disease than those with the least amount. So those who are catching up their sleep, so they've got the diaries of how much sleep people are getting through the week and then how much they're catching up. So that can be a nap on the weekend. It can be just getting up later on the weekend. And look, to be fair, depending upon your individual circumstances, particularly if you've got young children, doesn't always happen, but sometimes it does, and it might be at the end of the fortnight rather than the end of the week. Sleep deprivation can affect the immune system. We know that it, as I've said before, impacts on mental health, and there's a factor in high blood pressure and diabetes. Now, what is important in some of these studies is that other factors may also be at play. So could it be that the people who are catching up the sleep are prioritising their sleep as part of being more interested in their health? So might they be doing some more exercise? Might they eat more sensibly? So a lot of these, what they call confounders, can be tricky to remove. And in some respects, it's also a little bit like a car. Which part of the car works? Is it the tyres? Is it the battery? Is it the carburettor? Is it the fuel tank? Which bit gets you from A to B? Well, it's all of the above. So when we try to pluck out one single factor and say that is it, we're often going to be missing other things, which is why people sometimes get a bit frustrated. They say, look, I'm doing all this exercise, but I haven't lost weight, for example. Well, maybe if you haven't paid attention to your diet, or, I'm eating lots of vegetables, but I still got a cold. Again, just some examples that say and there's nothing that absolutely guarantees that you won't get a cold. But sleep is not well prioritised in our society. And there are estimates that at the turn of the 20th century, people slept on average 9 hours each night. We didn't have electric lights. We didn't have the devices. They're actually very, very recent. They're a 21st century innovation, let alone 20th. When it was dark, people went to bed. There wasn't a heck of a lot else to do. And if you didn't have electric light, you had candles. Well, what are you going to do? You're not going to be watching TV, obviously. It might even be difficult to read a book. And back in those days, probably a lot of people didn't. So you went to sleep. And you got up probably at the crack of dawn, and you probably worked all day at some physical activity, so your work is more likely to be manual than sedentary, and you were tired, and what you wanted to do when you got home was go to sleep. More recently, again, we have this, I'm busy, therefore I'm important, and if I'm important and busy, I'm going to get less sleep, and it's almost like this badge of honour, and it's not a good thing, and there's never such a thing as a free lunch. So lack of sleep is impacting significantly in society. You don't see campaigns from big public health about it, because they can't tax it and they can't ban it. And they can't stop advertising. So therefore, you don't hear a lot about it. There's no pharmaceuticals particularly that are useful for sleep. A couple of exceptions, and for legal reasons, I can't mention those, but you might know what I'm referring to. So, therefore, as against, say, smoking or alcohol, you don't hear much about sleep from the powers that be. But just to take this all a little bit further, so obviously we need some sleep. It's good for our heart. One of the main functions of the human brain is to create memories. Researchers from Cornell University have found that during sleep, the hippocampus region of the brain goes silent, allowing neurons to reset so they can help create new memories the next day. Now, this is in animal studies, so again, take it as that. But for certainly, and we're getting towards that time of year in the southern hemisphere where exams, whether it's at university or year 12, or I suppose any year, end of school exams, are looming up, and it's often very stressful for people going into those exams, and they often want to stay up late and cram and study. Two things. Number one, if you don't get enough sleep, you're less likely to perform well. Number two, and this has been shown before, and this work confirms it, that if you're actually getting some sleep, what you've learned or studied the day before, and look, hopefully you haven't left it till the last minute, but I know it happens. Whatever you have learned or read or studied the previous day, if you're getting a good night's sleep, that will get consolidated in your brain better than if you don't have a good night's sleep. So rather than thinking as I'm cribbing from my study time, it's more I've done my study time. Now I need to let it digest, in inverted commas, for whatever better word one might want to find, so that when I'm doing my exam the next day, it's more settled in my mind, and this work, is confirmatory of that. So really important to be well rested. Athletes, before a big competition, they will seek to get a good night's sleep. If you're doing exams or anything on a morning, getting a good night's sleep is important. And again, obviously, people a little bit stressed, it can impact their sleep a little bit. Go to bed early, have a regular, have a good routine, make the room dark. There's a lot of simple things that can be beneficial. And one of the factors in terms of sleep, particularly in teenagers, and that's an issue too, surprise, surprise, when parents are perceived as distracted by their phones or other technology during social or family interactions, it can affect the mental health of children ages between 9 and 11, according to a new study in Canada. Parental technoference, what an awful word, is associated with higher levels of inattention and hyperactivity symptoms later in a child's life. Now, I don't think it's correct to say that if you're on the phone sometimes that's going to lead to ADHD in your children. But I think what it does say, and we know this, is children at younger ages, particularly, probably going to be more influenced by as a parent, what you do rather than what you say. Mum or dad's on their phone all the time. Well, they're bigger than me. They're sort of, and this is subliminal, not necessarily conscious. This must be the way to go. It's leading by example. So really, we often the boomers and the X's tend to get on the backs of their children and tell them to get off screens and hand up. I've done it too. But we also need to look in the mirror. And if we don't want our children and teens spending all their time on devices, then we need to make sure that we're spending less time on our devices as well. And it's a very, very simple thing to do. And, simple ways to get it sounds a bit retro, get a ball, go outside. If you've got a dog, go for a walk, get on the bike, go for a run, there's lots of things that you can do. Read a book. Now, in that instance, yes, you could use your Kindle or your device to read the book, but very, very clearly that's in place of a book with pages. So it's a different use of screen. It's not just scrolling through, the dreaded Facebook or one of those. Lead by example. And again, if we're getting off devices earlier, one of the better ways to get more sleep is to be off any sorts of screens at least 45 minutes before wanting to go go to bed. So let's prioritise sleep. Clearly good for our heart, good for our memories and brains, and if we're getting off screens, that's good for us, and it's also going to be good for our children. Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please subscribe, like and share. You can also follow it on all the socials. There'll be new content uploaded each week.